Okay, so today we're going to talk about omega-3 fatty acids. Now, when we talk about omega-3 fatty acids, they're considered essential fatty acids. Now, the word essential, we all know, means that it's not optional. It means it's important. It's something that you absolutely need. But when we look at physiology or health, the word essential has another meaning. And that meaning is, it means your body can't produce it on its own. You have to ingest it. You have to be getting it from your diet. So when we look at essential fatty acids like omega-3s, you have to be getting them from your diet. What's important to understand there is it's kind of like if you think about a car. You could put in the best grade gas into your car and fill that tank up. But if the battery's dead, the car won't run. And it's the same idea with essential nutrients. It doesn't matter how well you think you're eating and all the other nutrients maybe you're getting. Maybe you've got tons of vitamin C and you've got tons of iron and you've got all the protein you need. If you're short on omega-3s, your cells can't function properly. And we know by definition, if my cells aren't functioning properly, I can't be optimally healthy. So we know that we need to get these nutrients into our system. Now, where do you get omega-3s from? Omega-3s can come from your diet. So we can get them from eating things like fish. We can get them from eating organ meats. Now, the problem with organ meats are going to be these organs filter out a lot of toxins, and if the animal wasn't healthy, you're getting all those toxins into your system. So that might not be the best choice. You can also get them from plant sources. So plant sources would be things like flaxseed, would be things like borage oil or evening primrose oil. The challenge we face there is even though those are good oils for you and they give you omega-3s, our body needs animal-based, because we as humans are animals. We need animal-based, which are EPA and DHA omega-3s. The plant-based ones are called ALAs. Now, your body can convert ALAs to EPA, but it can only do it at a 6 to 7% rate, which means if I need a teaspoon of omega-3s from a fish oil, I would need 15 times that amount in ALAs in flaxseed or borage or evening primrose oil. So you can see how that could be a little bit difficult. Also, how much is my body going to be effectively able to convert even if I took large amounts? So just something to consider if you're a vegetarian. If you're looking at any omega-3 deficiency symptoms, you might want to go ahead and add a fish oil into your diet to make sure you're getting your proper levels of EPA and DHA. Now, if I'm short on EPA, DHA, my omega-3 levels are low, what kind of symptoms can I have? Well, we know that omega-3s are incredibly important for reducing inflammation. Now, inflammation will be associated with things like joint pain. So a lot of our patients come in, they've got neck pain or they've got back pain, they've got different joint pains. You're going to feel better and you're going to heal faster if you get your omega-3 levels up. But inflammation goes a lot further than that. When we look at almost all chronic diseases, inflammation's at the root. Heart disease, cancer, diabetes, depression, all have inflammation as part of their root cause. In addition, things like autoimmune diseases, rheumatoid arthritis, things like fibromyalgia, psoriasis, eczema, also things, inflammation at their root. So we can see that the effects of having high omega-3 levels, reducing our level of inflammation, allowing our cells to function better, has potential to decrease a lot of different problems that we can face chronically down the road. So not only is there a short-term benefit of feeling better with your joints, but there's a long-term benefit of protecting you against a lot of these chronic illnesses. We don't want to take omega-3s like we would take a drug or a medication from a doctor just to treat symptoms. We want to take our omega-3s because we know they're essential for our cells to function properly and to allow us to have good health. So take your omega-3s, get a good fish oil, and be healthy.